Do you always feel tired and exhausted all the time? No energy for anything, and with the slightest effort, you run out of steam? Do you live in a state of constant tension, anxiety, and sometimes feeling depressed? Do you have trouble sleeping? Difficulty concentrating or recalling information, as if there is a fog cloud around your mind? Does your whole body ache most of the time? Your muscles always tense and stiff? Do frequent headaches leave you unable to do anything? Do your arms and legs go numb for no reason? Does your digestive system alternate between constipation and diarrhea, cramps, gas, and nausea? Is your hair falling out? If you've answered yes to most of these, you might have fibromyalgia, a modern day epidemic. Let me explain. Today's episode is one of the most important episodes I have made. I will talk about the problem of fibromyalgia, its causes, its symptoms, its diagnosis, and its treatment. Today, we'll give hope and open a new door of hope for fibromyalgia patients that they can improve and return to being a normal person who enjoys life. The main reason this episode is one of the most important I could make is because I'm talking about a problem that unfortunately many doctors and many patients don't have enough information about. And there are people who suffer for so many years and whose lives and the lives of those around them are affected abnormally because their condition was not diagnosed properly or treated correctly. The first thing I want to say to the fibromyalgia patient, who by the way 75 to 90% of those affected are women between 30 and 50, is that if you have fibromyalgia or have been diagnosed with fibromyalgia, know that this disease is not dangerous, and with proper treatment you can return to your normal life. So it's a challenging condition but not a life-threatening one. That is the first message of hope I send you as a fibromyalgia patient. Of course, I discussed the symptoms in the intro of the video. I always say that half of the treatment is knowing the correct diagnosis. If fibromyalgia is diagnosed, that counts as half of the treatment. The other half, which we will discuss today, is the treatment itself. First, I want to note, and I always say this, that this video is for educational purposes and not a substitute for direct medical consultation. Do not use the internet to self-diagnose or self-treat. I'm merely trying to raise awareness and provide you with scientifically grounded information that may help you choose the right treatments and discuss them with your doctor. Or maybe you can try some of the non-pharmacological or natural measures that may help your condition. I talked about some of the symptoms in the intro and mentioned many key ones. Widespread pain throughout the body, shoulders, upper back, neck, headaches like migraine or tension type headaches, concentration and memory problems, foggy thinking, depression, inexplicable crying, constant tension, hypersensitivity to stimuli, low tolerance for activity, digestive issues like IBS, skin problems, excessive sweating or very dry skin, hair loss, sleep disturbances, numbness in the hands and feet. These are the hallmarks of fibromyalgia syndrome. Fibromyalgia is notoriously difficult to diagnose because it's a diagnosis of exclusion. You must rule out all other potential causes of these symptoms first. Unfortunately, statistics show that the average person waits 5 years or more for a proper diagnosis. I have seen this myself numerous times at my clinic. Patients with disc issues or muscle pain treated incorrectly when the real culprit was fibromyalgia. We typically see women presenting for physical therapy with a constellation of symptoms. Sometimes they have already had an MRI showing a small disc bulge in the neck, leading to misdiagnosis. That's why all medical specialties must study fibromyalgia to recognize suspicion and refer appropriately. Now, which specialist treats fibromyalgia? The primary specialty in medicine is either rheumatology or neurology. So you either have to see a rheumatologist or a neurologist / neuropsychiatrist. These are the fields that have fibromyalgia expertise, but you always want to make sure that you ask if your clinician is experienced in treating fibromyalgia. So always ask if they have experience treating fibromyalgia, because that makes a huge difference to your outcome. Diagnostic criteria hinge on specific tender points in defined body areas and exclusion of other conditions. There is no single lab test or imaging for fibromyalgia, unfortunately. Only tests to rule out other rheumatic diseases or vitamin D deficiency. So what are the key statistics? 75 to 90% of fibromyalgia patients are women, ages 30 to 50. The average diagnostic delay is 5 years or more. 80% have daily chronic pain. 43% require medication for depression or anxiety. 90% experience constant fatigue. 40 to 70% have IBS symptoms. 70% suffer severe headaches extending to the neck and shoulders. Now, what really causes or triggers something like fibromyalgia? Number one, physical injury or surgery can trigger fibromyalgia. Number two, emotional trauma or loss of a loved one. Number three, viral infection. Number four, postpartum hormonal or psychological changes. Number five, genetic predisposition. Number six, chronic stress, especially when it comes to marital breakdowns. Also, neurochemical imbalances affecting neurotransmitters and hormones can cause fibromyalgia. Now, treatment requires a comprehensive program. So what is the proper protocol for treating fibromyalgia? Number one, pharmacotherapy. There are 3 FDA-approved fibromyalgia medications, and your doctor will choose the right one for you. Number 2, psychotherapy. We're talking here about cognitive behavioral therapy to reframe thinking and break the cycle of tension and depression. Number 3, relaxation therapy. Techniques to reduce muscle tension and stress. Number 4, hydrotherapy. Swimming and water exercises significantly improve symptoms. Number 5, physical therapy is very important. We're talking about manual therapy, medical massage, acupuncture, dry needling, therapeutic exercises that should be tailored to your condition and progress appropriately, because too much exercise can actually worsen the symptoms. We have to address muscle spasms first, then gradually load with exercises. Lifestyle modification is very important. Your diet, what you eat, you have to emphasize fresh vegetables, fruits, whole grains, think brown rice, whole wheat pasta, quinoa, healthy fats, lean proteins, magnesium-rich foods. Avoid processed meats, red meats, gluten, refined carbs, white sugar, artificial sweetener, MSG, excessive caffeine. So consider something like a DASH or a Mediterranean diet. Number 7 is family support. That is very important and essential. Caregivers and relatives must understand and support the patient. And last but not least, spiritual support. Faith and prayer as a source of hope and healing. In summary, there is real hope for fibromyalgia patients. You can improve and return to fulfilling an active life. If you found this episode helpful, please like, subscribe, and share it with anyone who might benefit. Drop your questions or experiences in the comments. I read them all. I'm Dr. Amr Ayad. Stay healthy, stay sharp, and most importantly, stay happy. See you next time.